What if one of the biggest risks to your long-term health was something you couldn't see, hear, or feel? Imagine a force silently at work inside your body, day after day, putting relentless strain on your most vital organs. This isn't science fiction, it's the reality of high blood pressure or hypertension. For millions of people, it's a constant companion they may not even know they have. It doesn't cause pain or obvious symptoms in its early stages, which is precisely why it's so important to understand. In this video, we're going to pull back the curtain and take a journey inside the body to see exactly what happens, step by step, when your blood pressure is consistently too high. Understanding this process is the first, most powerful step toward protecting your body's delicate and incredible machinery. Before we explore the effects, let's clarify what blood pressure actually is. Think of your circulatory system as a complex network of plumbing, with your heart as the pump and your arteries as the pipes. Blood pressure is simply the force of blood pushing against the walls of those arteries as your heart pumps it around your body. It's measured with two numbers. The first, or top number, is systolic pressure, which measures the force when your heart beats. The second, or bottom number, is diastolic pressure, the force when your heart is at rest between beats. A certain amount of pressure is essential for life. It's what moves oxygen and nutrients to every cell. The problem begins when this pressure becomes consistently, abnormally high, forcing the entire system to operate under a state of constant stress. Hypertension doesn't develop overnight. It's a gradual process. In a healthy body, your arteries are flexible and elastic, able to widen and narrow to accommodate blood flow. However, due to a combination of factors, which can include genetics, diet, lack of exercise, and stress, these arteries can begin to lose their flexibility. They may become stiffer, or the small muscles in their walls might stay partially contracted, narrowing the space for blood to flow through. In the beginning, your body is resilient and can compensate for this increased resistance. Your heart simply works a little harder. Because there are no immediate, noticeable symptoms during this phase, the condition can progress for years undetected, all while the foundation for future problems is quietly being laid within your blood vessels. The first and most fundamental damage from hypertension occurs at a microscopic level, on the inner lining of your arteries. This delicate, single-cell layer is called the endothelium. Its job is to provide a perfectly smooth surface for blood to flow over. But constant high pressure acts like a relentless physical force, causing tiny, invisible tears and injuries to this smooth lining. This damage makes the once smooth arterial walls rough and uneven. The endothelium also loses some of its ability to produce important substances that help regulate blood vessel tone and prevent clotting. This initial damage to the vessel walls is the critical first step in a cascade of events that can impact your entire body, turning a simple plumbing issue into a systemic problem. Once the artery walls are damaged, they become vulnerable. This sets the stage for a process called atherosclerosis. Think of it like this. If you have a perfectly smooth pipe, water flows through it cleanly. But if the inside of the pipe gets scratched and roughened, debris is more likely to get stuck. In your arteries, the debris includes cholesterol, fats, and other substances circulating in your blood. These materials begin to stick to the damaged areas of the endothelium, accumulating over time to form a hard, thick substance called plaque. This plaque buildup narrows the arteries, leaving less room for blood to pass through. This narrowing, in turn, forces your heart to pump even harder to get blood where it needs to go, which raises your blood pressure even more, creating a dangerous and self-perpetuating cycle. Your heart bears the most direct burden of hypertension. It's a muscle, and just like any muscle that works against resistance, it grows bigger. To overcome the high pressure in the arteries, the heart's main pumping chamber, the left ventricle, has to contract with more force. Over time, this extra workload causes the muscular wall of the ventricle to thicken and stiffen, a condition known as left ventricular hypertrophy. While a bigger muscle might sound like a good thing, in the heart, it's not. A thickened heart muscle becomes less efficient, requires more oxygen to do its job, and can eventually weaken. It struggles to relax properly between beats, impairing its ability to fill with blood, which can ultimately affect its capacity to pump effectively. The brain is incredibly dependent on a steady, healthy supply of oxygen-rich blood, and it is highly vulnerable to the effects of high blood pressure. The constant force can weaken the walls of the blood vessels in the brain, making them more susceptible to damage. This can lead to a stroke in two main ways. An ischemic stroke can occur if a piece of plaque from an artery elsewhere in the body breaks off and travels to the brain, blocking a vessel. Alternatively, a hemorrhagic stroke can happen when a weakened artery in the brain bursts under the high pressure. Beyond stroke, chronic hypertension also contributes to a gradual decline in cognitive function by damaging the tiny, delicate blood vessels that supply deep brain structures, a condition often linked to vascular dementia. Your kidneys are another primary target. These remarkable organs act as your body's sophisticated filtration system, cleaning your blood of waste products and balancing fluid levels. To do this, they rely on a dense network of tiny, fragile blood vessels called glomeruli. Sustained high blood pressure damages these delicate vessels, scarring them and reducing their ability to filter blood effectively. As kidney function declines, they become less able to regulate fluid and salt in the body, which can cause blood pressure to rise even further. This creates another harmful feedback loop where high blood pressure damages the kidneys, and the damaged kidneys, in turn, contribute to even higher blood pressure, accelerating the harm to the entire system. Even your vision can be impacted. The back of your eye contains the retina, a light-sensitive tissue that is essential for sight. The retina is supplied by some of the smallest and most delicate blood vessels in your entire body. When you have high blood pressure, these vessels can be damaged in a condition known as hypertensive retinopathy. The force can cause the vessel walls to thicken, narrowing them and restricting blood flow. In more advanced stages, it can lead to bleeding within the eye, swelling of the optic nerve, and fluid buildup under the retina. While early stages may not have symptoms, over time this damage can lead to blurred vision, and if left unmanaged, can contribute to significant and lasting vision problems. While this internal journey may sound concerning, the most important message is one of empowerment. Hypertension is a manageable condition, and you have incredible power to protect your body. Lifestyle modifications are the first line of defense. A diet rich in fruits, vegetables, and whole grains, and low in sodium, often called the DASH diet, can have a profound impact. Regular physical activity helps strengthen your heart and makes your arteries more flexible. Finding healthy ways to manage stress, limiting alcohol consumption, and maintaining a healthy weight are all powerful tools in your arsenal. For many, these changes, along with medications prescribed by a doctor, can effectively lower blood pressure and halt the silent damage before it progresses, allowing the body to function in a state of health and balance. Understanding what happens inside your body is the key to taking control of your health. High blood pressure works silently, but its effects are real and interconnected, touching nearly every vital system. By recognizing the process, from the initial strain on your arteries to the impact on your heart, brain, and kidneys, you equip yourself with the knowledge to make proactive choices. It's not about fear, it's about awareness and action. If you found this explanation helpful, please subscribe to the channel for more content that empowers you to understand your health. And don't forget to download our dedicated app, which you can find in the description and our bio, for more in-depth resources and tools to support your wellness journey.